Mitt Romney has called it an unconscionable abuse of power. Senator Jim DeMint says it's an insult to our democracy that threatens our nation's prosperity and freedom. Southern Baptist leader Richard Land says it will lead to the overwhelming majority of Americans living shorter lives and experiencing more pain and suffering before they die. What is it that's caused so much commotion? Well, it's the healthcare overhaul, commonly referred to as Obamacare. It was passed on March 21st, and it was a tremendous political victory for the Democrats and Obama. However, the vast majority of voters, 81% of polled voters, believe that the cost will spiral out of control. My claim, however, is that the healthcare overhaul that was recently signed into law will be beneficial and was a necessary measure to fix the broken healthcare system. No turning back now. My sources I used a lot of news sources, like I had one was from CNN, one was from Newsweek. I used the magazine The Economist. I had some from some nonprofit, like some reports from nonprofit organizations. And I also had one, was a webpage from the AFL, the labor union. So first, I'm going to talk about I'm going to explain why keeping the status quo was unacceptable. Second, I'll explain how this new system is designed to avoid pitfalls encountered in other countries around the world. And lastly, I'll show how the cost control measures will eventually reduce the federal deficit. So first of all, 47 million residents have no insurance, and 8.7 million of which are children. Healthcare costs are rising at 5 times the rate of inflation over the last decade. So, that's the last 10 years. I know recently inflation was kind of, with the recession, it could mean something different, but it's for the whole last decade. And the U.S. has some of the best healthcare in the world, but not everybody has access to that. And as a general, over the whole system, it's actually kind of mediocre. Medicare is a big government program. It serves over 40 million beneficiaries. Most people over the age of 65 are on Medicare. Staffing levels are dangerously low in hospitals, and as a result, medical errors are rising. And it's estimated that 44,000 to 98,000 needless deaths per year are resulted from this. Those are from things that could be prevented, deaths from neglect in nursing homes and hospitals. And spending is really high now. In 2007, the total national health care spending was $2.3 trillion. This includes federal spending, state and local funding, as well as private funding, which is the vast majority of it. So some of the benefits of the new legislation, everybody has to buy coverage, and this is put in place because now also insurance companies can't deny you on pre-existing conditions. So some people could not pay until all of a sudden they have a condition, where they need health care, and then they start paying and they can't be denied. Medicaid and Medicare will both be expanded, and subsidies will be provided for people who can't afford it. And if you already have coverage, it won't really change for a while. Everything's kind of being phased in. But the status quo is unacceptable, and Americans spend far more on healthcare than people in other rich countries, but die younger. America even spends more public money per head than many rich countries where the government covers everyone. Which brings me to my next point about comparing systems in other countries around the world. In the United Kingdom, they have a single-payer system. It's directly administered by the government, funded through taxation, and provided mainly by the public sector. It involves long wait lists and rations, and the priority is in cost control and not in the patients themselves. A lot of people are often denied because treatment is too expensive. In other countries, Denmark, people are generally happy with their healthcare there, but the government it's completely funded by the government, and healthcare research is done by the government, and they often stifle like innovative technologies that would be too expensive because they're not going to make something that they can't afford to give to everyone. France and Germany, healthcare is statutory right there, and they have a lot more of the private sector. And in Germany, 10% of the public opts for fully private insurance rather than government insurance. Some lessons from abroad are that research should be the role of the private sector, whereas the government should be primarily concerned with making information accessible. And the system should be supportive of quality, not just cost containment. And the system needs to provide incentives for innovation and efficiency. The U.S. model will be delivered privately. There is not even a public option, but it will not be paid for completely publicly also, because there will be subsidies. It will involve subsidies, but so people you have to buy your own insurance. Hopefully these new marketplaces that will be set up are designed to encourage competition between firms rather than stagnation. And the healthcare plan is focused on continuing reform in order to improve and reward quality. Now, for the cost control, spending will increase. That's just a thing that's a byproduct of covering more people. It's going to cost more. But some of the measures to offset the costs include the creation of a competitive market, which will drive down the cost. Reducing administration costs. Now, insurers must spend 85% of 85 cents of every dollar on actual health care rather than on administration. There's going to be a Medicare advisory board. Most of the reforms are centered in Medicare because it's such a big program. It has a big influence on the rest of the system. Also, there'll be incentives for researching comparative effectiveness, promoting prevention and wellness, strengthening primary care, and reducing avoidable hospital readmissions. These reforms are likely to complement each other and not be effective on their own, but effective in combination. The bill is designed to slow the growth rate of cost, which is more important than the price tag itself. In conclusion, the bill that was signed into law represents an entire overhaul of the system. It's not popular. It wasn't popular that Republicans unanimously were opponents of this bill, and it wasn't popular for the Democrats, and a lot of it wasn't popular for the Republicans. But their claims are real. They represent the concerns of real people. But they did miss a golden opportunity to improve the ideas of the bill, and instead they followed the most radical voices of the party. Democrats believe that once the measures in the bill begin to be enacted, the general public will have a more positive idea of the plan. This bill is designed to fix a flawed system and is structured to avoid the problems of other countries. Now that the bill is law, it will bring change that the insurance companies will have no choice but to believe in.